Hello everybody, welcome to UroChannel. I received an email from Alex, who is living in the States, and he asked me to do a video on numbness of the glands of the penis and whether I had some tips what to do about it. I get this question once in a while, and there are definitely some aspects worth knowing about. So generally, with aging, there is a certain loss of sensitivity which happens naturally, as it is the case with sexuality in general. Everything slows down as we get older, and penile sensitivity is no exception. But this could be aggravated by lifestyle, diseases, or medication. When it comes to lifestyle, typically bike riding might be a problem. Sitting for a prolonged time on a saddle, and the more so if it is narrow, will compress the perineum with the underlying structures. This means that the blood supply in this area will get diminished and nerves will be compressed. The result might indeed be a numbness that extends into the penis. When riding a bike, it is important not to sit all the time, but to get up every few minutes to decompress the perineal area. One could also buy a special saddle that are specifically shaped to spare this sensitive area. By the way, I'm not going to tell you any brand names, that will be advertising. Another lifestyle thing is smoking and alcohol. Especially alcohol is poisonous to nerves. A more sudden and pronounced loss in penile sensitivity might be a symptom of an underlying disease. Please pay attention to your fingers, toes, the ears, and the nose. Do you feel anything similar here? What do they have in common with the penis? Well, they stick out, and this makes them vulnerable. Diabetes is maybe the most common cause. I don't want to scare you off, so let me just briefly mention that there are also other diseases linked to neuropathic conditions. Neuropathic means that nerves are affected. These diseases include neurological disorders, autoimmune diseases, certain infections, bone marrow disorders, and so on. For a first check, I think you should get a general lab test to see whether diabetes might be an issue or liver and kidney disease. Thyroid disorders are a classic for lots of stuff going wrong, so make sure to assess thyroid function as well. For the doctors, just to tick a box on the lab sheet. More on the specific urologic side are diseases like Peyronie's disease, which may lead to a constriction and thus cause some numbness. If you want to know more about Peyronie's disease, I have a whole playlist of videos. In rare cases, also an advanced prostate cancer could theoretically cause compression of nerves and result in penile numbness. But this is something I have never experienced in real life. Overall, there should be a general examination with some basic neurological tests and measurement of blood pressure. In my opinion, an ultrasound of the penis should be performed as well, because Peyronie's disease can be found a whole lot more often than one would think. I just want to mention vitamins briefly. The B vitamins, B1, B6, and B12 and folic acid are crucial for nerve maintenance, meaning that a deficiency in these vitamins also might result in neuropathy. Then there are certain medications. Antidepressants, so-called SSRIs, may lead to penile numbness in certain cases. Chemotherapy may have a similar side effect. There's one more thing that I think is very important to establish in a medical consultation. Do doctor and patient talk about the same thing? What does numbness mean? This is important to find out because, for example, low testosterone might negatively affect sexual pleasure. The patient might call this numbness, whereas numbness in medical terms describes something different. So what could you do to help your nerves? Try to keep a normal weight, eat healthy, never smoke, drink little alcohol, change your sitting habits, change positions and include standing positions. Exercise regularly with a combination of cardio and strength training exercises. Especially for the pelvic floor, my advice is pelvic floor training, but only after pelvic floor assessment of a physical therapist who is trained in treating this area. Any existing pelvic floor overactivity might be counterproductive. I think yoga is good exercise also for the pelvic floor. Theoretically, shockwave therapy might be tried as it has no side effects and is proven to restore nerve function. If you want to know more about shockwaves, here's a playlist. Thanks for watching. Hope to see you soon in one of my other videos. All the best to you, Alex. Bye bye.